Hi, welcome to Addiction Recovery Place podcast, the podcast champion addiction treatment professionals around the world. I'm your host, Chris Langley, and I'm very pleased to introduce today's guest, Brittney Santillo from Nevada. Brittney is a licensed marriage and family therapist, a licensed clinical and alcohol and drug counselor, and an EMDR trained therapist. Brittney is licensed in Nevada, Utah, and Idaho, and she also has her own private practice called Helping Hope Counseling, which is also located in Nevada. Welcome to Addiction Recovery Place podcast, Brittney. It's great to have you with us today.
Yes, thank you for having me.
No, I really appreciate it. And obviously you're very, very busy, so we're just going to get straight in. So can you tell us about yourself and your journey to starting your practice and your career?
Yeah. So I am born and raised in Las Vegas. So I am an OG here. I think I'm like a fourth generation Nevadan at this point. So I've been here. My family's been here for a long time, on my mom's side anyway. So I'm really involved in the community here, and I really believe in mental health and kind of we could do a lot better. Obviously, we're getting there as a state, but not as great as I'd like to think. But anyways, so I did all my schooling here. I went to the University of Nevada, Las Vegas. I got my bachelor's degree in psychology. I minored in family studies, and then I went on to my master's program, and I did the marriage and family program there for 2.5 years. I graduated. Okay, let's see, 2015. I can't remember. Anyway, it was quite a few years ago. And so after that, I started doing my internship at a nonprofit agency, Bridge Counseling. And I ended up being there for 10 years actually. So I got licensed there. I did my 3-year internship. I got licensed. I became a clinical alcohol and drug counselor as well. And they helped me through all that licensure and did all that. I got EMDR trained under their roof. So they give me a really good headway start into kind of starting my practice, my journey into private practice. So I really thank them for everything that they gave me and kind of a really good footing. I feel like I encourage all interns to work at an agency at some point, because I really do believe in if you can see clients in that capacity, you can pretty much handle and tackle anything, right? So working there for 10 years, kind of in my last 3 years of working there, I started to kind of titrate into doing private practice. So I just slowly started taking clients in the early morning and the way late evening after I got off. And I just started kind of building slowly over those couple of years. And then finally I left the agency. I kind of went down to lesser hours, and I finally left the agency in June of this year. And I finally fully launched my full private practice. And so I've been doing that now. It's been 3 years, but I've only been doing it full time for a little bit of time, but it's been amazing, and I'm really having a good time doing that.
Well, firstly, congratulations. That is an incredible journey, and the fact that you're now starting your private practice and you're branching out on your own, that's incredible. So how long has this all taken you? How long ago did you start, and what made you decide to go into this field?
Yeah. So this one is I think everybody gets into the field for a reason, right? We're usually all in mental health because we all have our own stuff typically, right? But I am really driven by psychology. I always was. I took an AP course in high school, and there was just something about it that kind of just when all the things that happened to me as a child and middle school age into high school. And then it was kind of one of those whoa, there's a field for this kind of stuff. I didn't really know anything about it until I kind of took my first high school course around surrounding psychology and things like that. But and I was just always curious about the why and why people did what they did. And I felt people were always drawn to kind of want to talk to me anyway and open up and tell me their stories without me even didn't ever understand why or why people would approach me for those certain things, but they would anyways. But other backstory. So the real reason why I probably got into the field most of the time. So my father struggles, I think still struggles with addiction. Not quite sure. He's not in my life currently, but so he struggled with meth use, alcohol, gambling. I kind of grew up, I didn't really know till later, but domestic violence. So my mom used to get beat by him and stuff growing up. Finally, my mom left him when we were kind of starting in high school and things like that. And he kind of just completely disconnected from the family and kind of always felt like he's picked his addiction over the family and us and things like that. Obviously, I've worked through a lot of that stuff, so it doesn't really affect me like it used to. But so I really think that's the reason why I was always just motivated and wanting to understand why people did what they did, or why maybe people would get into that realm. And I didn't even know that studying addiction was even a thing until I got to Bridge Counseling. So then once I figured out I could do the mental health part and then also help people with addiction, it was like, oh wow, that's like amazing. So I love the fact that I was able to pursue both. And I don't know, inherently, I probably just feel like I've have like just empathetic qualities and maybe just my energy and like what I can bring into the room. I've always felt like I can really connect with a lot of people. And so I think maybe that's the reason why too. I've just always been able to really just like connect with individuals on a personal level. Not so much in big crowds. I really don't like big spaces and things like that. But on an individual basis, I've had a really like just special connection with people. My supervisor used to say, she's still my mentor, actually. I get to talk to her every now and then, still frequently. She was always used to say to me, like, oh, if a wall could talk back to you, it would. I'm like, I didn't, like, I don't, just like, I think my inability to join with people has gotten me this far, and I think continues to grow me in my private practice. So I think that's been a really beautiful journey to be able to meet all certain people, different walks of life. It's just what a great thing that I get to do every day.
Well, you've certainly got the right energy. There's no doubt about that at all, Brittney. I've seen that you work with families and couples. So, what is it you most enjoy about working with this client group?
Yeah. So families, I did a lot more in bridge work, just because we worked with people who had their children kind of taken through CPS. They would get like their children taken away. So we would help with like the reunification process and things like that. So I did a lot more family work there. I know like a lot of MFTs actually, believe it or not, don't actually like to see couples, which is kind of sad. I get referred for couples all the time because like a lot of MFTs don't want to see them. So MFTs see your couples, they're fun. But I love working with that group. I think that they are like the dynamic is just so like so rich, and just like it's beautiful to kind of see two people come together even at their worst, but even then to get them to their best. I think it's such a great journey. I have worked a lot with in my private practice. I think maybe being in Vegas, I don't know if we just get the ability to kind of have all people from different walks of life and lifestyles, but I work with a lot of couples that are like alternative lifestyles. So maybe like polyamory or open relationships and things like that. So to kind of help create like a really safe environment for them to talk about those things openly and honestly and be able to hold space for each other in that regard has been really great. Um, I've worked with a lot of couples with like infidelity, obviously addiction, right? Because since my background in that too, I get a lot of referrals for couples. Maybe if one is struggling with something, or alcohol use, or maybe smokes too much, or does, whatever it may be, plays video games too much. Is it a complaint that I hear a lot about the video game world? So I'm kind of helping couples navigate through those kinds of things too. And conflict, obviously, like basic communication and those kinds of things too. It's been really great and a lot of fun.
That sounds incredible.
Okay.
Very, very interesting work that you're doing.
Yeah.
So one of your specialities is EMDR. So
Yeah.
how successful is using this therapy, or when do you suggest using this for your clients?
Oh man, EMDR for individuals, right, is my go-to approach. So the great thing about EMDR is I know that it's been coined really for like the people who have PTSD and like kind of like more severe trauma, but I really use it for, I mean, anything like super small stressor to anything like really, really big, right? So the measure for EMDR, what we've been able to do with it as a field, I mean, incredible from where it used to like just kind of pause and stem from. But I use it for clients who have like little T's, right? So little traumas depending, but obviously I don't want to minimize anybody's trauma. So like, that's always dependent on how the client views it. Immediate crisis, because I did work with like first responders for a kind of a little bit of time. So like maybe if they saw like a big traumatic thing, like, right, they could book a schedule and you could kind of reprocess and do that like for them right then and there. People who even have anxiety, right? So replacing some of those maybe negative narratives and negative thoughts, you kind of have to do EMDR a lot more to kind of create those new neuropathway connections, but you can do it for anxiety. Even with addiction, believe it or not, I'm not trained in this. Like, I know that EMDR has its own like little protocol for addiction, but you can get trained and more certified, like more ingrained in it. But I've done it for like some addiction work as far as like in that regard, like creating different narratives and different pathways, or learning how to kind of like break that mold of addiction, but I'm not specially trained in that. So, but you can do it in that realm too. But trauma is really where inherently where you want to mostly obviously advise for clients to take it. And, I mean, like it can heal from like past experience to something that happened like yesterday to like, even sometimes repressed memories come up too in regards to EMDR. So sometimes you might have a protocol for the day, but then something else floods, and it's like, well, let's just switch to it. And kind of that's why it's important to do it with a licensed therapist who's been trained in it, because if you don't, like, sometimes you can inherently, like, not really harm a client, but it can definitely bring up like other things if you're not ready prepared for that, how to ground the client back to like to groundedness, or like kind of like switch and kind of do it on the fly. It can be a little bit damaging to the client. So you want to make sure that you're actually trained in it with somebody who actually specialized in EMDR.
Absolutely.
Yeah.
So it could be used for a whole wide range of issues. So from
Yes.
not, as you said, not trying to discount trauma, but something that's considered small to something quite major. So okay, it's really interesting, because I've spoken to some other therapists on the podcast about this, and it's something that's quite. I'm finding out about it as well, so I find it fascinating. So thank you for answering that. That's great.
And
I love
therapists, don't be afraid to get I know it's kind of a little bit expensive in the beginning, but like I really encourage, I think every therapist should be trained in it, or at least know a little bit about it, to be able to guide then for like their client to go like seek out other therapists who then formally trained in it. Because I really do think it really helps heal the mind and the body to be more congruent. And I think not to say you can't get that with talk therapy, but you can get there a lot faster with EMDR for clients who struggle with trauma.
Yeah. So anyone listening to this podcast that's going into this field, you would recommend looking into training for this as well?
If you're going to put money into any training, I think that should be the one that you should do it for.
There we go. Excellent. All right. Just so you know, anyone's listening. Excellent.
No, I don't even get like paid by them or anything, but maybe they should start thinking. I'm just kidding, but like I think it's great.
Excellent stuff. You previously worked in the criminal justice system as well, Brittney, with some clients facing felony charges. Can you explain how this worked, and how do you get felonies reduced to a lesser charge in the criminal justice field here in America? I'd love to know.
Yeah. So while I was working at Bridge Counseling, we collaborated with a lot of court system and a lot of just judicial systems of like so like felony courts, like misdemeanors, like DUI specialty courts. We worked with federal programs and probation departments, right? But the specifically one that we worked with was the felony DUI program. So it was clients who had 3 or more possible DUIs, maybe, and yeah, we're strict, but not so huge. So typically, but these are clients that had definitely 3. So instead of getting the felony and maybe facing prison charges, they would enroll in this program, right? So it was 3 years long. So I know it's a long program. They were enrolled in treatment the entire time, but they would titrate down. So they would start like 3 times a week where they would engage in group and then individual. They're being drug tested now the entire time that they're in this program randomly through the court. So like, we don't have anything to do with that, but they call a number and they kind of like get called in to go do drug testing and things like that weekly. So their treatment kind of titrates down over time, as long as they don't get any slip ups or any kind of in trouble. They're on probation the entire time too that they're in the program. So once they successfully complete, they go back to court, they kind of close out their case. The felony then is reduced to a misdemeanor.
That's well a 3-year program.
Oh yeah. And most of it, like in my work there with Bridge for 10 years, I stopped kind of seeing some of the felony just because it's hard to work with the court system sometimes. You don't get as much freedom. You kind of have to do things like kind of their way, which is fine and everything like that. But I had like way more success than I ever did. Like I hardly had ever clients like that had to get like fully terminated or didn't want to do it anymore or whatever. Like there was way more success in that. Now, I don't know what it looks like after they finish the program. I don't know how many studies and things that they've done for clients, who have left the program, and how well they do with their continued sobriety, or if they enter, or if they bring alcohol back in their life, like what that looks like. I don't really know about those studies, but while in the program, most clients seem to do very well.
Wow. So people stayed in the program for 3 years.
Yeah.
That's incredible.
Yeah.
That's great. That's testament to your work.
Oh yeah. Well, I think too, Vegas is not very felon friendly, despite what a lot of people may think. So I think for clients to know like how hard it is to get housing here or jobs, right? Because we're a very entertainment like heavy industry and things like that. So you have to do a lot of background checks, and most casinos and things like that are in like, they're not going to hire you with certain background, right? When they can just hire somebody who has like no problems or issues, right? So I think for a lot of clients, if they want to stay here and live here, like it's really important not to have that felony on the record.
Yeah, definitely. Yeah. Almost definitely.
Yeah.
Just going to talk about your state for a little bit, because obviously in the United States, we're seeing a massive fentanyl opioid crisis. It's affecting every community. So how's Nevada coping with this? Are there any harm reduction services available, such as fentanyl stations or even needle exchanges that are available in your state?
Yeah, I had to do some research on this actually, because um where I worked, right, Bridge used to be able to give out like naloxone and certain things like that with syringes because we had like a grant and funding. I don't know where they're currently at with that. They might still have it actually. I'm not quite sure. But like there is like in Nevada, there is like they do a lot of harm reduction programs. I'm not quite sure about like the northern areas and things like that, but I know that like Nevada has like a website. It's like the Nevada DHHS, and they have like all the facilities and things like that that house like needle exchanges or not like yeah, and have like certain things like certain like Desert Parkway obviously is a big one here. They're like one of the major hospitals here for mental health and substance abuse. So a lot of people get a lot of things through that. I know like we have a health center out here. We have one for like the LGBT community. Um, I think they're just called the center, which I know it seems like a stretch, but I think that's the name of it. And they have a lot of things for like HIV and and certain things like that that you can get. The health district we have out here has a lot of things too. But I'm not quite sure about rural Nevada, like up in like the northern states. But I know that I think they probably have a lot more actually probably up there, probably because they just get a lot more funding than we do down here in Vegas. Because I know, like, because unfortunately, there's only certain things that Vegas kind of cares about when it comes to funding, and mental health is probably not on the tippy top of their list. But we do have a lot more as far as like agency work and things like that. Like clients can go and get like help and support in that regard. But as far as like maybe finding services for like safe places to get it or needles and things like that, or like things like syringe exchange programs, probably not so big in that regard. But as far as like being able to set up for like for treatment and IOPs and like inpatients and certain things like that, like we have a little bit more probably than they do up north in that regard.
So Nevada is not running away from the problem. It's actually trying to deal with it
I
because
think
I
they are. I think they are. I think obviously we could always be doing better, but I think probably every state and major city could probably say that too. So
yeah, I've been hearing different answers to them. It's
have
nice to
you?
hear. Yeah,
Yeah.
it's been quite interesting, and this is a question I ask everyone on the podcast because it's
Yeah.
interesting to find out what's going on.
I also think because of like a lot of the crisis with opioids and stuff, and I think since it started so much more in the East Coast, I think they probably have a better handle on it and like how to deal with it because they've had it over there for a lot longer than we've had on the West Coast, just because I think we've had other problems and issues. Like you know how like drugs, unfortunately, some substances are like they're coined to certain areas for some. I don't know why that is or how that works or whatever. But so I think the opioid since it started so heavily on the East Coast, I think they probably have a lot more funding and resources and things available than probably we do out west, just because I think we have a different drug problem or crimes and stuff. Like I think it's just different depending on where you're at in the
Yeah,
states.
yeah, that makes total sense.
Yeah.
You mentioned earlier about drug testing, Brittany, and
Yeah.
on these podcasts, I've heard time and time again about clients being tested for drugs and finding out that they're testing positive for fentanyl even when they've just used something like marijuana. Is this an issue in Nevada, would you say?
Yeah. So currently, I mean, luckily I don't have to collect pee anymore. That's not in my job description anymore, thank goodness. But when it was, because we did have an IOP program at Bridge, so sometimes we'd have to drug test clients or for CPS or certain things like that, right? And even state probationers. And since marijuana is legal here in Nevada, right? There's some core entities, right? Like people who like have their children, like CPS and things like that, or state probation, they can't really say that they're not allowed to use, right? Within reason, right? So if they test positive for marijuana, we can't really say like, oh, you have to be sober from like everything, right? Even though that's our policy as an agency, but like if even probation or CPS is like, well, we don't really care what they do, like we don't really have much say in that, right? So clients will continue to use, right? Or even if they come in on their own will. Marijuana is like the one besides alcohol, like it's probably the one that we see the most, right? So like during certain like settings and things like that, like yeah, I would have clients that would come like heavy marijuana users, right? They would test positive for marijuana, but every now and then they would get a spike in something, and I think sometimes that just depends on like maybe where they're getting their marijuana, where they're getting that, right? And like some people probably don't always go to dispensaries and things like that because it's a little more expensive, possibly. But yeah, I definitely have seen it a lot in the and my agency work and things like that. And that's like really sad to know the clients don't even know sometimes what they're getting. And, sometimes too much of that can unfortunately, create an OD and certain things like that, which is really devastating, but happens a lot. And they know a lot of people too that are like suddenly OD'd and things like, people that they've known for years of, then that tends to happen, which is really sad.
Mhm. It must be a bit of a shock for clients to come back testing fentanyl when you've been smoking just some pot.
For sure, because
Yeah.
they're like, that's a huge. I mean, like they're like, what? I don't even know. Most clients don't even know what it is either, right? Like some people aren't even educated to even know like what that is and like what that means or like what that's even made. Well, I think people don't even because they change the compound all the time, so who knows what's right? Because they try to dodge certain things all the time, so they're constantly changing the compound so they can kind of be undetected or whatever the case may be in certain drug testing environments. So the fact that it's constantly changing too and things like that, I think some clients don't understand the gravity of the situation if they were to even use just a little bit.
Mm. I had a guest on the podcast who described the dispensaries as harm reduction now because of what's going on, and that was a real turning point for me as well when I realised that the legalization has some real benefits as well. Obviously, there's a lot of negative press around it, but when we got a fentanyl crisis where people are smoking cannabis and they're
Yeah,
testing for fentanyl, it just seems a bit of a no-brainer, really.
for
Um,
sure.
so how's legalizing marijuana in Nevada help with funding schools and addiction services, as well as reducing incarcerations for simple possession? How has this helped? Is money going back to where it's supposed to be, would you say?
So I did a little bit more research on this too because I was curious after we kind of chatted a little bit about it. So it was legalized back in like 2017. And since then they I think I don't know how recent the study was, but it's nearly been $1 billion in tax revenue from marijuana use since 2017, which I mean it's a hefty price tag. So there has been some things that have been funneled into addiction work. They didn't really have numbers because they said like it varies from year to year, probably just from whatever they have, maybe like leftover or maybe whatever has gone to other things, right? But for schools, it's been about 60 million that they've distributed over the time since 2017 to help with like new programs and improvements in it because Lord knows I still think we're 48th or 49th in education. I'm not quite sure. So like, yeah, whatever, but and then it has helped definitely with incarceration, though we do definitely see like less people in jails and things like that for like little small possession or whatever the case may be related charges. So it definitely does help with that in regards to like the jail system as well.
Yeah, it's good. It's good to know that the money is at least being pumped back into some good causes.
I sure hope
That's
it
nice to hear.
continues to. I sure hope
Yeah,
it continues.
yeah, most definitely, especially in
Yeah.
a state like Nevada where you have other vices, should we say? Shit,
We have, this is the adults playground here.
sure is, dearie me. So I'd just like to ask. I ask people about this because stigma has such an effect on people who want to access services for their drug use. This has been a time-tested problem. So why do you think in this day and age that this still is a problem? So why is stigma still a barrier to people accessing services?
Yeah. I still think societal views on addiction, I think that a lot of people aren't still educated about it, right? And maybe just don't understand like how addiction can come about, right? And I think nowadays, I think everybody's probably been touched by addiction to a certain degree, right? You probably know a family member or a friend right? I think everybody's kind of been touched by addiction to some degree. But whether or not you learn about it, I guess, is a little bit different, right? But I still think there's very like negative perceptions on drug use. And I think a lot of people still feel that, and I still get this even like, in Nevada, as like kind of like open-minded as a city as we are, but like, I still think it's tied to like people who use like, maybe as they're weak, maybe, right? Or like there's moral failures in that regard. Like, they succumb to addiction and other things or things like that. Right. But also there's just a lot of shame and like, in
Mm.
seeking help, I think still, right? Like knowing that like you have to actually ask for help or knowing where to go to even ask for help sometimes can definitely, you know, reinforce somebody to kind of just stay in their addiction instead of maybe getting or asking, or maybe they have, and maybe it didn't go well, or maybe they got that, like, or maybe it wasn't helping the right ways, or maybe what they needed, or maybe they kind of got judged in some kind of passing or along the way, so it's hard to know exactly why, but I think that I think it's because we don't have enough compassion in the field to like really like, help people in the ways that they need it. And I think that this work is still very new. I think, right? Like as far as like how to really help people through these things, I think we're still kind of learning and growing as a community and really like what is the best recipe? Because it's not a one size fits all kind of thing, unfortunately, right? So we try to be cookie cutter things to set things up, but it's not always going to work for everybody, right? So I just think that we just need more community outreach and less stigma around it. And I think we have to get away from labeling people and being like judgmental around it about it, because everybody has a story, and there might be, I think there's always a reason and a why somebody might go down that avenue. And I think it's just important to understand that maybe that's the only thing that they knew how to go to, or maybe they saw parents do it or friends do it or whomever, right? So like there's a lot around it. And I think people just want to close those people out and not really like help them, but kind of just be like, oh, like not my problem kind of thing, right? And shun them more from society, and then kind of bringing them in and kind of figuring out how to help them in the best way possible.
Yeah.
Yeah.
You said something, more community, less stigma.
Yeah.
I love that. That pretty much sums it up. It really does. It really does. So thank you for that.
You're welcome.
Last couple of questions. I ask all my guests this because I get some really interesting varied answers, but can you tell me what your opinion of harm reduction is and how it can play such a role in recovery?
Oh, okay. So I did mention like in the one before, right? So it's harm reduction is not a one size fits all model either, right? In this approach.
Totally.
So I do believe in harm reduction, right? Even though the agency that I worked at, like with court mandated folks, like they had to be sober, right? They didn't get a choice to kind of like titrate down right on certain things, but like they had to kind of like just stop and like, and figure it out. But with some substances, I really do think it can be really effective, right? Like I'm not going to say like probably like methamphetamines is like more like hard, right? Like I think I've never met like the occasional meth user, right? So it's like one of those things where it's kind of just like they're either all in or like they're not. It's like harm reduction in those kinds of spaces. We're like, oh, I'm just going to use like a little meth today, like, I don't think like that's necessarily, that's probably not going to be helpful. But I think with like marijuana, I do think with like alcohol to a degree, as long as they're not like to the point where, like maybe they're like, some people need the alcohol in order to kind of like function, because for like if they get the shakes and certain things like that. But I think you can do it with like marijuana, depending on like the ability of like pill use. I'm kind of like a little worried about that. But even like with like heroin and opioid like use addiction and things like that, I think you can kind of like you have to be very monitored, right? And really have somebody come alongside you in that program, right? And to kind of like hold your hand through that process, because withdrawing from any kind, especially like an opioid or like a heroin, can be very like, deathly. Sometimes you have to be really careful with how you do that process and what that looks like. So I do think it can be done, but I think it has to come with a lot of support, a lot of people around you, and a lot of will and determination to actually like titrate down over time. And I think we see it a lot with like cigarette use, right? Like tobacco and things like that too, or even like even something as simple as like caffeine, right? Like that I think harm reduction can be great for that, but it takes time. You have to be patient with yourself and everyone around you and kind of learn like what's best for you over time and how to do that effectively. And even medication management in between, like, you know what I mean? If you could get something to kind of help with aiding cravings and certain things like that, like you really have to have like a whole team around you, I feel like, if you're going to do harm reduction.
Yeah, most definitely. Definitely. That's a perfect description. Thank you for that.
You're welcome.
Do you have a message for anyone who's listening to this podcast who is going through addiction or a mental health trauma at the moment?
Yeah. So, I thought about this and I was like writing some down because I was like, I don't want to read it like a letter, but I did anyway. So I was like, I don't know what people need to hear, but I kind of just put like, to anyone who is struggling with addiction, I want you to know that you're not alone. Addiction can feel like an isolating and overwhelming experience, but there is always hope. There's always a path forward, no matter how far you may feel from it right now. What you're going through does not define you, and there is so much strength in taking even the smallest steps towards healing. Every moment is an opportunity for growth, and you have the power to change your story. It's okay to take it one day at a time, even one step at a time. No one expects perfection. Recovery is not linear. It's okay to like stumble, take a few steps forward, take a few steps back. But what matters is that you continue to find the courage to keep rising again. I encourage you to lean on support around you, whether it's a therapist, family member, a friend, or a community that you can feel safe in that understands what you're going through. There's no need to face it alone. There's always many resources and people that are willing to walk alongside you. You just have to be able to find them. Above all, be kind to yourself. Addiction is a struggle. You're deserving of compassion, respect, and care. No matter where you are on your journey, know that you're worthy of love and support and a future filled with possibility. Keep moving forward even when it's hard. Your story is still being written, and that one can be filled with hope, healing, and transformation.
Wow. No, that was incredible.
Oh, thank you.
That's a lovely message. It really was. So thank you for that. And thank you for your time
You're
today.
welcome.
Last question. Can you tell our listeners how to best to contact you and to find your service online, Brittney?
Yeah. So like I said, so I just started my LLC kind of this year. I don't have like a website up and running, but I am on Psychology Today. So you can always find me through that. You can just type my name in or whatever, and I will pop up. And I mean, yeah, really, Psychology Today is probably the best way to be able to find me currently. But
Excellent. Yep. We'll make sure we have the links in the podcast so anyone can contact Brittney.
Perfect. Love that.
Well, Brittney, thank you so much for joining me today. It's been fascinating speaking to you. It's lovely to hear that you've branched out in your very early in your new journey with your service to yourself. And congratulations on everything you've achieved and for helping so many people. It's been a real privilege talking to you today. Thank you so much.
Thank you for having me. I really appreciate it.
Thanks, Brittney.